Good morning and welcome to today's New York City Council hearing for the Committee on Children and Youth. If you wish to submit testimony, you may at testimony@council.nyc.gov. At this time, please silence all electronic devices. Just a friendly reminder, no one may approach the dais at any point during this hearing. Thank you so much. Chair, we are ready to begin.
Good morning. I'm Councilmember Althea Stevens, Chair of New York City Council Committee on Children and Youth Services. Welcome to today's hearing on DYCD's Family and Supportive Services. In addition to serving the city's young people, DYCD offers a broad spectrum of program that serves low-income families and communities. DYCD's 6 family support services include the Father Initiative, Healthy Families, Senior Services, Economic Development, Adult Literacy, and Safety Awareness and Crime Prevention. Using a strength-based case management approach, providers work with individuals or families to assess their needs and resources to help them obtain support. Apart from the Father Initiative, those 5 programs fall under the Neighborhood Development Area Contract, which is funded through the Federal Community Service Block Grant Program. The NDA programs were founded through a 2016 community assessment that DYCD distributed through the city's 41 low-income communities. DYCD surveyed residents around the programs and services that they needed, but had not received in the previous 12 months. The result of the surveys was supplemented with an input from community members on neighborhood advisory boards to develop priorities for residents. The critical programs were designed to help individuals with families at or below 125% federal poverty levels. DYCD framed the program as essential services to help New Yorkers in New York City move into recovery after the economic devastations of COVID-19. I applaud DYCD's grassroots approach that uses community capabilities to address the causes and conditions of poverty, but those DYCD programs are often overlooked and rarely promoted. The long-standing vacancies on the neighborhood advisory boards must be filled so that we can strengthen this process and amplify the resources to residents who need them. Additionally, there is a depth of data on the program's outcomes and reporting on the metrics used to evaluate program success. My dual objective today is to learn the quantitative and qualitative measures used to assess a family support program and identify ways to further promote the services so they are more accessible to New Yorkers who need them. I'd like to thank committee staff for their hard work in preparing for this hearing, policy analyst Elizabeth Arts, committee counsel Christina Yalmanti, as well as my chief of staff Lamont Carolina and Jata, my legislative director, and the entire A-team back at District 16. I would like to also acknowledge Councilmember Williams, Councilmember Joseph, Councilmember Lee, and I believe Councilmember Mena is remote.
We will now hear testimony from the administration. Before we begin, I will administer the affirmation. Please raise your right hand. Do you affirm to tell the truth, the whole truth, and nothing but the truth before this committee and to respond honestly to council member questions?
I do.
I do.
Thank you. You may begin when ready.
Good morning, Chair Stevens and members of the Children and Youth Committee. I'm Mike Bobbitt, Deputy Commissioner of Community Development at the Department of Youth and Community Development. I'm joined by my colleague, Ebony Jordan Wilson. On behalf of Commissioner Howard, thank you for this opportunity to update the Council about DYCD's family support programs. We appreciate that the committee is uplifting some of our lesser-known programming. The Fatherhood Initiative and Healthy Families and Seniors programs are services that help improve the lives of NYC families. As you may be aware, these programs, along with others, are funded through the Federal Community Services Block Grant. Since 1996, DYCD has served as the community action agency for the city, receiving federal CSBG funds and distributing those funds to local programs in accordance with the goals of the federal statute. CSBG funds enable DYCD to provide services for the most vulnerable New Yorkers. Through these funds, DYCD aims to reduce poverty and empower people to achieve self-sufficiency in targeted low-income neighborhoods throughout the city's 5 boroughs. Fatherhood is funded citywide, while Healthy Families and Seniors programs are funded through the neighborhood advisory boards, which are in 41 communities across the city. I would be remiss if I didn't thank Chair Stevens' efforts to encourage local elected officials to appoint members to the NABs. We would be delighted to meet other members of the council to discuss the NABs and our easy appointment process. The Fatherhood Initiative was established in 2002 in recognition of the positive influence that fathers have on their children. Children who have strong relationships with their father are less likely to get into trouble at home, school, or in the community. An active and nurturing style of fathering is also associated with better verbal skills for infants, greater patience for toddlers, and better intellectual functioning and academic achievement among adolescents. For the past several years, the program has supported a diverse group of community-based organizations that specialize in working with disconnected youth, child welfare, working with the formerly incarcerated, and workforce development. Programs offer a robust staffing model with case managers and outreach and retention specialists. This model supports the recruitment of custodial fathers and other peer mentors for program participants, enables them to offer voluntary monthly co-parenting workshops for interested custodial moms, increases awareness and coordination to address child support and visitation concerns, and better ensures appropriate screening and referrals to providers of legal services, mediation, domestic violence services, and other necessary social services. Programs are targeted in community districts with a high need for fatherhood services based on the number of children born to unmarried women and the number of individuals on probation. In city fiscal year 2023, a reported 1,067 non-custodial fathers reconnected with their children. DYCD's fatherhood programs partner with many city agencies and state and federal partners, including the New York State Office of Children and Family Services, New York State Department of State, and the United States Department of Health and Human Services Administration for Children and Families. We work with these partners to promote a flagship event, Dad's Take Your Child to School Day, each September. This statewide campaign encourages fathers and male caregivers and male role models to show their children the importance of education by visiting their schools at the start of the year and staying involved throughout the year. Many dads served by our programs have embraced this challenge, and the participating CBOs have developed additional referral sources through burgeoning relationships with schools, after-school, and Head Start programs. As part of our efforts to continually improve fatherhood programming, DYCD has provided targeted training and technical assistance to assist programs in initiating outings for dads and co-parents to attend, including museums, picnics, grocery shopping, etc., at which co-parents can demonstrate appropriate behavior and share parenting roles managing the engagement of their children. The Neighborhood Development Areas Initiative, or NDA initiative, fosters community-level engagement to ensure both that residents have opportunities to contribute to change in their neighborhoods and that services address the most pressing needs of each community. These contracts address 7 service areas, including the 2 we are discussing today. Seniors, the social, cultural, and supportive services. These programs provide a range of services for adults ages 60 and older, such as social, cultural, and recreational activities, intergenerational activities, exercise and nutrition, and access to social services to improve their physical, social, and emotional well-being and increase self-sufficiency. These programs serve both those who are homebound and those who are not. Programs must offer assistance in accessing services and benefits, social, cultural, and recreational services, and family development coaching. They assist participants in demonstrating self-advocacy skills and improvement of mental, behavioral, and physical health and well-being. Healthy Families Support Services programs aim to support and strengthen families using a holistic, strength-based approach based on the principles of family development. Last year, DYC Healthy Families programs worked with 5,140 families to address issues concerning child care, domestic violence, substance abuse, HIV/AIDS, and physical and mental well-being. This includes advocacy and assistance in obtaining government benefits and other social services. Each program offers services tailored to community support service needs, which can include SNAP, WIC services, avoiding eviction, nutritional skills, and weatherization assistance. Funding decisions are made by hearing directly from New Yorkers in what services are most needed in their community. In 2022, DYCD conducted a robust community needs assessment across the 41 neighborhoods with the highest incidences of poverty, as well as citywide. This CNA aimed to document their views on what are the highest priority social service needs to improve the well-being of their own communities. DYCD collected over 24,000 usable responses from a total nearly 30,000 responses. In conclusion, we'd like to share a story of one of our many successful program participants. A dad served by our Fatherhood Initiative thanked the program for its tangible and meaningful support. His child and co-parent lived in another state, causing his absence as a father to be even more apparent. Not wanting to be an absent dad, he struggled to identify a pathway back into his child's life that felt appropriate and attainable. Recognizing the need for support, he found and reached out to one of the fatherhood programs funded by DYCD. Unlike some fathers who are mandated to attend programming, this father began and completed the program as a voluntary participant. Attending a 12-week course and working with dads in similar situations motivated him every week. Each week brought him closer and closer to being the father he aspired to become. He strived to be a present father and a positive male figure in his child's life. Like many others, his goal was simply to be involved and be a dependable parent for his child. Upon completing his classes, he next expressed interest in finding employment. The case manager at the program reached out to a partner organization to refer the dad for an employment opportunity where he was hired. After a few months, he was offered a permanent position. During his time with the program, the dad built a closer relationship with his co-parent, to whom he apologized for previous grievances and his absence. Insights gained from being in the fatherhood program shifted his perspective and allowed him to see the co-parent in a new light. Their co-parenting relationship was reinvigorated, and the father worked to repair the dynamic with newfound appreciation for the co-parent and her efforts to care for their child. He was even able to participate in a parent-teacher conference while visiting his child in another city. His dedication to the program presented him with the opportunity to be a better father using the tools and the teachings provided to him. DYCD's mission is to improve the quality of life of New Yorkers by collaborating with local organizations and investing in the talents and assets of our communities to help them develop, grow, and thrive. Thank you for the opportunity to share DYCD's efforts to serve New York's low-income individuals, families, and communities. We're pleased to answer your questions.
Thank you. We have a number of questions, so I'm going to jump right into them. Since 1996, DYCD has served as a community action agency, CAA, for New York State. What has been some of the key achievements of the neighborhood development area programs, and what more can DYCD do to uplift and promote those programs?
I missed one word of your question, Chair. What were the key, what, I'm sorry?
I asked what were the key achievements of the neighborhood development area programs, and what more can DYCD do to uplift these programs?
Thank you, Chair. It's a great question. So I joined DYCD in 2010, so I have some reflection from colleagues who were there when I joined, and then I have some reflections over the period of time since I've been there. This hearing allows us to focus somewhat on the NDA, or the Neighborhood Development Areas Initiative, and I think one of the strengths of that initiative is that we've continued to label it as an initiative. Because we do a robust community needs assessment every 3 years, the initiative is allowed to adapt. Because we review the periodic shifts in poverty across neighborhoods, we're able to revamp the initiative so that we're both targeting services where they're needed most, and that we serve as a listening station to the community as to which needs are most needed. So I think that we've enjoyed success and been useful because of the dynamism of the NDA initiative. And to the second part of your question, one of the things that me and my team are very proud and excited about is under the leadership both of the Adams administration and Commissioner Howard, we've really embraced one DYCD mantra. And so these services, which you acknowledged at the outset, and I said in my testimony, we only have a limited amount of federal money, so it's very important that we're able to try to leverage those dollars. And so whether internally or externally, we're talking about youth services or youth workforce services, there's a conversation about community development and wraparound services for families. So I think that that's a strength that we've embraced and can continue to lean into going forward.
Please explain the role and responsibilities and goals of the Neighborhood Advisory Board, the NAB.
Thank you. As a community action agency, we are one of maybe 1,000 agencies nationwide that look to combat conditions of poverty. One of the important ways that we demonstrate and make good on that charge, which is a 60-year charge now since Lyndon B. Johnson launched the War on Poverty, is to demonstrate the maximum feasible participation of those who are impacted by poverty. The neighborhood advisory boards allow DYCD, or I should say enable DYCD to do that strongly. By targeting services in the communities with the highest incidence of poverty, we also recruit volunteers from those communities, so people who live, work, and play in those neighborhoods, who are acutely aware of the conditions on the ground. They are DYCD's partner, whether it's participating in our community needs assessments, leading the public hearings related to those community needs assessments, and then ultimately when the services are determined need to be procured, the NEB members join us in reading the funding proposals. So we make community action come alive by enlisting and partnering with members of the community through this program.
How many vacancies are the neighborhood advisory boards across the city currently?
Thank you, Chair. So as I said, there's 41 NEBs, and each can seat up to 12 members. We have 263 active members right now. We have 223 vacancies. DYC considers a board viable when it has 7 or more members. So we have many viable boards, but we would love to have vibrant boards with full attendance. Of the vacancies I listed, 63 vacancies can be referred by council members, and I want to thank you again, Chair. You're aware of this, and you've clearly and consistently demonstrated the importance of it and enlisting the attention of your colleagues. We would like to continue to do that, to fill as many of the 63 vacancies as we can. There are also 33 vacancies that can be filled by New York State senators, 31 vacancies that can be filled by assembly members, and 43 that can be filled by members of Congress. So we thank you for raising this forum to do that, and if you have advice or suggestions to help encourage other local elected officials in the way that you have done with members of the council, we would be very glad to do that.
Well, my office has not only been reaching out to council, they gave us the full list, so we've been reaching out to the state, and next couple of weeks we have all those vacancies filled, so we will continue to work in partnership with you all to try to get these vacancies filled, because I do think it's important. Why do you think that there's so many vacancies on the NAB, and how many people at DYCD are responsible for covering the NABs?
Great questions. I'll take the second one first. One of the teams under community development is the Neighborhood Advisory Board Liaison Unit, so I'll just use NABLU as a shorthand. We have a senior director, a director, and we have liaisons, and it's their job to go out in the community.
How many is?
There's 4 liaisons at present. So each of them have a number of neighborhoods that they target across, as I said, the 41 boards.
So there's 41 boards and there's 4 people?
4 line staff, and then we have a director and a senior director. So the director carries some of the boards as well. So you have maybe 8 or 9 boards per liaison.
Oh, probably why you got vacancies.
There's a lot of beating the feet that they do, and to break out each board, DYC at its discretion can seat up to 6 people. And what we're trying to do as another way of evincing this maximum feasible participation is to partner with the local elected. So we don't want to put people in seats without the local elected officials having referred those persons. So, most of our boards have 6, 7 people. We want to get them to 7, 8, 9, 10, 11, 12 people. We do regularly meet and liaise with DYC's external affairs team, because obviously external affairs has a lot of ongoing report strategies, including the virtual meeting that you attended some time ago. We want to replicate that meeting. As to why there are vacancies, volunteers can serve 2 3-year terms. And we do have a number of volunteers who are seasoned. Some people sit off the board and they want to come back later on. I think sometimes people just live busy lives. They do a term of service and like, all right, I gave. It's time for somebody else. I think that can be an issue. Sometimes there's mobility. People live in one part, be on that board since it's a hyper-local board.
Yeah, obviously, especially when we're looking at communities that have so much poverty, they probably are trying to get things so they can get in better circumstances, like working and taking care of families. But I am concerned about there only being, like a total of 6 people in the department. That this is really good work, and so thinking about maybe if there was more support, they would be able to kind of do some of the legwork, even with like reminding the elected officials around the vacancies, because as we've been calling and my office has been reaching out, when I tell you almost no one knows what I'm talking about, no one has no idea about what this is, if they have these appointments, what the appointees do. Like, it was like, everybody's like, what is this? What are you talking about? Like, I had people telling my office they were lying. The outreach on this is not really happening in a way that I think is making sense. And if it is supposed to be a partnership, we have to really think about how are we making sure that the people who should be making these appointments are aware of it and have a good understanding, because it's been taking us a long time because we've been having to do so much work on helping the elected's office understand even what this is. And so there's a big disconnect in this. So I definitely want to make sure we spend some time after this to kind of think about how do we continue more of an information session.
Yes.
And even thinking about, right, when we leave, how do we continue to have that continuity with the elected officials? Because, you know, we have term limits, right? But even at the city level and at the state level, I'm telling you, they were just like, what are you talking about? What is this? And then there was like even people giving us pushback, like, no, that's not what they do. That we don't appoint them. I was just like, why would I call your office and lie? So we definitely have to do a bigger push around information and letting folks know what this is.
We would welcome that. There's some things that we've tried out fairly recently, but we'd be very happy to revisit and look at how to expand them. There was a time where we didn't have some of the marketing materials that we do now. We have brochures. The application itself, we're able to make, to streamline so that people can fill out the application if they want to become a board member directly. We would love to routinize, maybe annualize that meeting that we were able to have that you attended, and I'm sure that there's more that we could do. We'd love to.
We definitely need to kind of like think through that a little bit more. And even with the surveys, I remember last year when that was like going on, I know you guys use a lot of the programs to kind of get the survey out and things like that, but also thinking about how do we use that opportunity to partner with the electeds who have to make appointments to also get these surveys out and use in their office as a way to engage in this process. So I definitely have ideas, and we'll definitely want to take time to kind of talk that through a little bit more. Do you think the community needs assessment accurately reflects community priorities, and how are the results of the survey distributed back to the NDAs?
I do, and they are. I want to say a little bit more about that, and Chair, I know you're familiar with how the NABs work. So again, consistent with this idea of the maximum feasible participation of those impacted by poverty, hearing directly through residents, through the street surveys that happen. We expanded that. Most recently, we did the community needs assessment by making an online survey available as well, by hosting public hearings. And I say host, but it's really the NAB members that host, and then we help facilitate to make sure they run the meetings. And I will acknowledge several members of the council, as well as state senate and state assembly members have attended some of those last public hearings. Those are things we want to keep going. Current providers, past providers come out to those hearings too, so I think that it's a forum for us to hear a wide range of perspectives, and what emerges from that are the highest priority needs. The way that we have funded the NDA in relation to that is to look most carefully at the needs gap question. So when people say, what are the highest priority needs of the neighborhood, we're also asking them, what have you needed that you haven't gotten? And that's helped inform the design of the programs they do. So I think that we have a consistent and a coherent approach where we're listening very carefully to New Yorkers, to residents who are affected by poverty.
And if this is so successful, why are we not like trying to incorporate this through all the programs throughout DYCD and getting more of a voice and input, and using this model, because if it's happening and we think it's been working so well, and getting input from the community members in this way, why are we not kind of expanding this through all of the programs through DYCD?
Well, I actually think in many ways we are. So I'll give an example. This is from the prior administration. After we did the 2016 Community Needs Assessment, when food insecurity was realized to be such a priority area, it caused us to reflect on the discretionary council-funded food pantries in a different way. So we've always been supporting that work, but the opportunity to really amplify and raise further attention to that work became much clearer. Another thing that I recall from the 2016 Community Needs Assessment, SYP, which has a wide range of funding and is at a much larger scale than the federal programs we're talking about today, through doing this neighborhood-focused review in the Community Needs Assessment, we saw that there are neighborhoods that were what we might have termed SYP deserts. And so we had helpful conversations internally between community development and the youth workforce team about looking at program siting. So the information that comes out of the needs assessment is tapped and is accessed throughout the agency and externally. Like, we share this information with other city agencies. So over the course of the winter, we'll be finalizing a report from the 2022 Community Needs Assessment. Once it's finalized, we'll certainly share it with the council. And we have every interest in sharing the information, so it's not just attached to a particular RFP. It's information that's made available generally and broadly. And we have put them on our website, but we want to do more to not just our website, to try to market it more broadly. We've talked with the Mayor's Office of Engagement. We think there's broader audiences than maybe there was in the past to share and use the information.
Since 2001, all CAAs, including DYCD, have been required to report on program performance. Since the current NDA contract went into effect in 2022, what have DYCD reports concluded about NDA program performance? Can you share the report with the committee?
Yes, thank you. We have shared these reports historically, and we'll follow up later on to make sure that you get the most recent. I believe the most recent share was 2022. I'll double check after the hearing, but we're working on a 2023. So I believe it was 2022.
Yeah, it was 2022.
So we'll have it when we complete and transfer the 2023. We'll get that to the council. As a community action agency, DYC relies on a nationally recognized framework called ROMA, which stands for Results-Oriented Management and Accountability. Some principles for results-oriented management include assessing poverty, which we've sort of discussed already, needs and conditions in the community, defining a clear mission and strategies and services to address the needs, and identifying specific results to be achieved. Some of the principles for results-oriented accountability include developing and implementing processes to measure and record improvements in the condition of people with low incomes. So we espouse this throughout the CSBG-funded portfolio, and we use a national rubric of service indicators and outcome indicators. So when we enter into contracts with providers, along with enrollment targets, there's anticipated impact from the programs. Because DYC has a central database, a participant tracking system, as providers are working on the contract and enrolling participants, they're able to upload both qualitative information, their case management notes, as well as validated proof when the outcomes from their work are being realized. And we're able to aggregate that information. We do aggregate that on a quarterly and on an annual basis. So we'll continue to share those reports with the council.
Thank you. Why aren't the metrics for the NDA programs included in the mayor's management report?
I don't want to speak out of my depth, but I think the short answer is I believe that they are. I can carry back and follow up with the council. There's an internal method through which the mayor's management report takes advantage of what I'm talking about. So they may have a different rubric that they're using, but my team checks with the planning, program integration, and evaluation team on a routine basis, and we report numbers into that.
Yeah, that was one of the things as we were preparing for this, that was one of the things that we noticed, that it wasn't in the mayor management report, and we were confused on why that was, and really wanted to figure out was it separate or was it being reported somewhere else?
Sorry.
No, go ahead. No.
It is, but I'll follow up with you later on so that we can figure out a clear way to illustrate how the numbers that I'm referencing are interpolate into those numbers.
So it's just probably not clearly distinguished. And so that's, because when we were looking, like I said, when we were looking and we were doing the research for it, that was one of the things that like kind of stood out to us, was like not being distinguished as, you know, the NDA programs, or this is separate, maybe it's being rolled in, but that was a little bit confusing. So definitely we can follow up with that. In 2020, Neighborhood Development Area Concept Paper, DYCD added economic development and safety awareness and crime prevention as new program areas, and disconnected youth programming. What feedback did the agency receive from the 2016 community needs assessment that led to this change?
Thank you, Chair. Well, as you know, we conduct the CNA every 3 years, and as we've discussed, the CSBG funding is minimal, relatively minimal, and we try to be flexible and adaptable as we are learning things. So we made an institutional determination to adjust the NDA mix of programs rather than provide duplicative services. So I'll give you a little illustration. Is at the inception, the last cohort of programs, when we had the Opportunity Youth Program, there was a belief that while DYC already had an array of youth workforce programs, it might be useful to have another program that didn't have some of the educational requirements of those programs. And so that was one of the reasons that we precipitated on launching Opportunity Youth Programs. We did an internal review, and we engaged an MWBE vendor to do some further research on that portfolio. And it turned out that there were some programmatic and operational challenges with operating the program. Persons who would have qualified for our other youth workforce programs were actually, is ending up being duplicated. They were being enrolled in the same kind of program. So the target audience we saw wasn't really being reached. And like other NDA programs, and now I'm getting a little wonky, I apologize, but like other NDA programs, they're hyper-specific. So you're enrolling people in the main, in the neighborhood, and the wages would be paid out of the same allocation. So in order to do that program, when it was piloted, the wages were paid for, the workshops were not. So when we had youth that enrolled in that program and they found about other youth workforce programs that were paying for them to be in workshops, well, I'd rather be in that program. So when those things happened, we saw there was an opportunity to shift and to lean into a reinvigorated version of a program that the agency hadn't supported since 2003, which was the Economic Development Program. And I'll add this, there's precedent for this before, because under the last administration, when there was a dramatic expansion of after school, there used to be NDA high school and NDA middle school programs, but we didn't need to have NDA middle school programs when there were city tax levy funding that was amply supporting after schools, who were able to lean further into some of these otherwise unaddressed needs.
Under the stakeholder engagement in 2020, the NDA concept paper the agency said interviews were conducted with providers who withdrew their contracts prior to the end of their contract terms to learn more about the administrative and operational reasons.
Some providers, I'm sorry.
No, I was going to finish the quote.
Oh, sorry.
For doing so, what are the reasons providers pulled out of the contracts, and what did DYCD learn from those interviews?
Some providers reported they felt there were constraints or additional constraints because of the federal funding and administrative requirements, and that made the contract harder for them to operate. So in terms of what DYC learned from that, one, in terms of our stakeholder engagement, I continue to believe this is a necessary leg of the stool. We want to talk to current providers, but we should continue to talk to anybody else who gave back a contract to know why. And we look where we can to clarify or to minimize any undue administrative burdens, although at the same time, and our hands can be somewhat bound because we have to report both to state and federal regulations for the use of this federal money.
So then how do we then alleviate this from happening again, right? If there's like additional issues that some providers are seeing, how do we, moving forward, try to rectify some of those things?
One, what I think significant change we made with this round of the NDA RFP is, whereas historically we had a contract floor of $50,000, we raised that to $100,000. So that does mean with a finite amount of money, there's a lesser number of contracts, but it also seems to mean, and I think the response we've gotten providers, it is the case, that it gives them more money to work with and they have more viable contracts. So they're able to both do their programmatic work and attend to the administrative requirements that are placed upon us by state and federal oversight that we have to convey to them.
How frequently does DYCD meet with community or communicate with NDA program providers?
How frequently? Providers are brought together on a quarterly basis by every program type, so that now, since the pandemic, we're able to do a lot virtually. We'll meet virtually. In the first couple of years of the pandemic, we increased that, so we were meeting on about a monthly basis because the pandemic was so disruptive. And we use those not just as oversight meetings, but as a peer share, and we continue to use as a peer sharing forum. So if there's promising or best practices approach that some of them are trying, we want to make sure as a community they're able to do that. And then finally, we use those as an opportunity to introduce other resources, other city agency and otherwise.
The Healthy Program assists families in accessing resources for a range of needs, including domestic violence, substance abuse, health and nutrition, and assistance in obtaining government benefits and social services. The Family Health Program addresses a broad spectrum of issues. What are the primary care providers are addressing in those communities?
Healthy Families programs, as you rightly point out, have a broad array of services and opportunities that they can work with families around. So that could include SNAP or TANF, securing Social Security benefits, emergency food assistance, transportation services, employment or domestic violence supports, mental health services, safe temporary shelter, helping families avoid eviction, heat assistance, utility payment assistance, documentation such as Social Security cards, driver's license, birth certificates. So it's a pretty broad range of activities that they engage in.
How many individuals and families did the Healthy Program serve last year?
Last year, 5,143 individuals and families.
What methods are program providers use to promote these services and recruitment of the clients?
Many providers operate the contracts out of their main administrative site, and they leverage existing community relationships that they have. Some of the community partnership, 3 community partnership agreements are required by the RFP, so that's a minimum, although providers may have more than those 3. What does that mean? A community partnership agreement, like a referral agreement, so like they can make and receive referrals. Yeah.
I'm sorry, I'm a little out of it. Yes.
No, I appreciate that you're holding up very well. Sure, yeah. And additionally, we have some marketing materials that we made available that are very client focused, which I'll share with the council later.
And you know, this is always one of the things that I'm always curious about, especially with programming. How are we integrating this into all the other programs that you have, right? Because so often, and this is one of the things I'm always yelling about, where, like, for example, I feel like we collect a lot of information, but none of the stuff that we need, right? So, like, when young people for SYP, we're asking them for a Con Edison bill, but we're not asking them if they're in the shelter, or if they need additional food, or things like that. And then this would be a great place to have that information and then give them referrals to a program like this that can then help them with the services. So how are we cross-pollinating this work that's going on in these programs, and how do we get to a place where we are collecting information that we can then use to refer them to programs that we already have within the agencies?
Thank you. I'll give you a couple of examples, Chair, and then we're always up for brainstorming about further ways to leverage. So one, within the portfolio, in the enrollment process, there's some questions that we ask. And to your point, like, don't ask information that you don't intend to do anything with. So we ask at enrollment if the family, I'm sorry, I didn't hear you.
No, I was saying we have a lot of that in our programs.
Yeah, we'll try to make use of what we're asking for. So we ask at enrollment if the family doesn't have health insurance and wants to be approached by someone about that. So that's not just out of curiosity. We have a memorandum of understanding in place with Metro Plus, since they are the health insurance enroller in their quasi-relationship with our sister agency, Health and Hospitals. And so we periodically turn that information over. So again, these are participants who say they do wish to be contacted. And health insurance enrollers don't just target on Metro Plus. They can review all the health insurance plans that may be available. So there's HIPAA regulations that limit how much information we can get back about that information, but we do have cooperative conversations to just try to understand, like, generally how well are those referral relationships going. That's one. Another is we ask, similarly, if they want to be contacted with someone about assistance getting their taxes done. Because from the information we're aware of from Department of Consumer Worker Protection, basically anyone who would be enrolled in a community service block grant funded program would qualify to get their taxes done for free. And so we do a push out every year before tax time to let people know about DCWP programs, and we also encourage our providers throughout the year to do that. There's also, what's the other, the VITA centers? No, the VITA centers is the taxes, I'm sorry. Yeah, it's the same thing I'm referencing. And I thought I had a third. What's the third? We've been talking cooperatively with our sister agency, Administrative Children's Services, because, as I'm sure the chair is aware, they've been expanding their family enrichment centers. So we want to engage in mutual referrals between those programs. So
Well,
that's
I love
one
to hear
for
that you guys are talking, because you guys know how I feel about we don't be talking with each other.
We're talking. We're
so
talking.
that makes me a little bit happy.
The last thing I want to say real quickly is that under the leadership of Commissioner Howard and the One DYCD mantra, I'll give you examples. Like, for instance, as you well know, a year ago when the Office of Neighborhood Services was integrated into DYCD, that was a great opportunity to really cross-pollinate work. And so over the past year, my team refers to community development as really community development plus public safety. So if we have programs, which we do, that are targeting interventions to young people to try to desist from violence, young people live places and young people have family members. So some of the programs that we're reviewing right now, Healthy Families programs, we want to make sure that the folks who are doing those interventions know about those programs. If you want the youth to desist from violence, you also want to support the family. So we want to use models like we have, and so we've already been embarking the past year on that.
Yeah, I know, because I was yelling out about that for the first 2 years, and so I think they wanted me to stop yelling about that. But I just have a clarifying question, because you had mentioned earlier that, like, in the application, you're asking if they want access to health care and things like that. And you're saying that that is part of the Healthy Families, like that's part of their paperwork for when they're going in to get these services, correct?
Yes, and. So the question as it's framed is, if you don't have health insurance, do you want to be contacted about it? And we ask that as part of the Healthy Families application, but also part of all the other anti-poverty program applications. So we ask it of seniors, we ask it of even the NDA high school.
So my question is then, even if we wanted to just look at the NDAs, why don't we ask those same questions for kids who are applying for like SYP, the after-school program? Like, then why do we just not use that matrix across the board then?
We did, actually. I forgot to mention. We piloted it, and then we've expanded it across the agency. Okay. So we do.
I got to check in with that one.
We have a unit. I'm sorry.
I got to check in with that one, because I ain't hear that one yet.
Identify yourself. Yeah.
Hi, Ebony Jordan Wilson, Assistant Commissioner for Community Development. So we have a universal application at DYCD, so those questions appear on all of them.
Thank you.
I got to check in. I haven't seen the application in 2 years, so I'll go look. I'll look, and I'll bring it back. I'll let y'all know. What is the cost per participant for the contracted Healthy Families program providers?
This is it, right? Yeah. $952.
That's a little low. I see why people are sending back these contracts. I'm going to pause here and make space for my colleagues who might have questions. I think Councilmember Joseph has a question.
Thank you, Chair. I'm going to make you smile just a little bit. I used to be the chairperson in my NAB in 2007, and I served under Councilman Senator Parker appointed me. So, and we used to meet at my old school when I was an educator, or forever educator. Good morning. Thank you for being here. I just have a couple of questions around your fatherhood initiatives. And as I was talking to the chair, this is like a big secret inside the agency. We want to see you robust engagement, robust advertisement for the programs to support fathers. We know that's needed. So how many fathers have you served through this initiative since 2023?
Thank you for your participation in the NAB, and thank you for your question. 2023, we served 1,225 dads.
How are the majority fathers come to know of your service? Are they referred, walk-ins, and how does that work?
It's a wide range. Some of the consistent referral partners have been Administration for Children's Services and Department of Probation. They do receive walk-ins. There's also a positive word of mouth, so sometimes clients who may not initially have wanted to be in the program, but once they are in the program and they find it a welcoming environment, they will let other dads in their personal network know about the program.
That's good. Is the service mandated through courts, ACS, or voluntary?
It's not mandated from DYCD's perspective. We make the services available. Some of the referral partners may have set that as a condition. So if there's an allegation of abuse or neglect, ACS may require the parent to perform certain things to demonstrate why they can have access and rights to their child. Again, we support that as well as many other circumstances dads may be facing.
Okay, so that's one way to get them back in the relationship with their child through ACS referral.
Yes.
Okay, good. So what outreach does DYCD do to ensure that fathers are aware of this program? Is it other than ACS, courts, volunteer? Do you go to college campuses, or is this available in public schools? I used to be a public school educator. I never saw this program come across. I used to do a program called Don't Laugh, Donuts for Dads, and it was one way. It was one way to get dads into the building to talk about them, because they usually are left outside of the conversation when it comes to education. But we look to dads for discipline. But I always think it's a holistic approach into serving families. So
No, I very much agree with you. There's a wide array of things that we attempt to do. So one, the providers themselves are always recruiting, and in the staffing model, there's both case managers and outreach and retention specialists. So one of the anecdotes I like is one of the programs in Queens, one of the staff will regularly go to Home Depot. And outside Home Depot, you know that there are disaffected young men and say, hey, brother, you need some help with it. Like, I got a program for you. Like, go where people are.
That's
Actually,
right.
go walk by a playground in the afternoon. So some of our programs are smart enough to enroll staff that understand those realities and can speak to men in those situations. There's things that DYC does essentially too. So for several years, we've had our staff join, or DOE, or now in NYC Public Schools, whenever parent coordinators are meeting, or there's a conference of things that they can do. I mentioned in my testimony, Dads Take Your Child to School. There's a great campaign and a vehicle, and it's an excuse. So if fathers haven't been on, or fathers or male caregivers or role models haven't been on people's radar, let's look at the start of the year. Let's invite everybody in. These events are never to slight mom.
Of
so
course.
mom can have donuts too.
No, I do muffins with mom. So donuts with dad and muffins with mom.
I like the alliteration. So we do those things, and then more recently in this administration, the commissioner has supported our doing and affirming fatherhood convening. So we've done that twice. We anticipate doing that again this coming June, holding for a date. I want to acknowledge the Councilmember Riley actually spoke at the last event, and I really appreciate his consistency on that front. We try to do what we can. One of the things, I don't want to go on too long, but one of the things I think we've noticed, and I said it in sort of a teasing way, sometimes dads don't want to be in the program until they're in the program. So we've created with the programs, we've created alumni spaces. So even though you got what you came for, once you found a welcoming environment and spaces where otherwise some dads may not feel there's a safe place to talk, stay, and then use what you've learned to pull the next brother into the program, but some of those folks can then go on and communicate. So this is a direction that we want to continue to lean. And I think of that especially as I'm mindful of Mayor Adams when he references Bishop Tutu. You see people falling in the river, you pull them out, but you have to go further upstream to find out why they're falling in. I think of the Fatherhood Initiative very much as being aligned with that.
Chair, can I ask two? Thank you. Out of how many boroughs do you operate?
We have programs in all 5 boroughs. That was important to us when we procured in the current round we hadn't had a program in Staten Island before. We wanted to be sure that we were in all 5 boroughs.
How do you measure success? You need your assessment.
There have been 2 measures, and under the current RFP, we added a third. There's a survey that's conducted. We call it a survey, but I'll refer to it as a facilitated interview. So when a dad comes into the program, the case manager will sit down with him and ask him a range of questions that include things like, how often do you see your child? Do you owe formal child support? Do you pay? Do you have arrears, or do you have informal arrangements? What's the relationship like with the mom? And then as dads spend time in the program, both with their case manager, doing their parenting skills and other programming that an individual provider might have for them, they return to those same questions every quarter that the dad remains in the program. And when the dad's reported score, we have Likert scores behind some of those questions, emotional engagement, financial engagement goes up. The program has demonstrated they've met the outcomes of the program. So that's the way it's worked for a while. And we added, as I said, a third measure, which is these are anti-poverty programs. So if the dad is able to show validated proof, was unemployed, is now employed, was homeless, has now found a residence, they can earn an outcome by helping stabilize the dad. So we'll say any two of those three shows that you've worked hard in meaningful ways with the dad.
When participants stop attending, what's the tactic to get them back into the program?
Wide range of things that are done. So one is we support the programs that you don't have to exit someone once they've been enrolled till the end of the year, because we know adults are busy and they might disappear for various reasons. We've heard anecdotally sometimes somebody gets locked up or moves or whatever the case may be. During the pandemic, when services had to move to virtually, that was a boon to some of our programs that serve adults, and the fatherhood programs were among those programs, because now a dad could be seeking employment and could still dial in to be with his program. So we try to offer programs all reasonable flexibility. And I mentioned a moment ago the staffing model, hiring persons with the cultural competence to be good at engaging this particular population is important.
What's the percentage
Bless
of
you.
fathers that complete the program?
A moment. On the wrong page. Bless you.
Bless you. Bless you.
Last year we had 69% of the dads who started completed the program.
And you said you work with fathers that are justice involved. What support do you provide for justice involved fathers?
We have one contract that focuses on dads with prior criminal justice involvement, although all programs have familiarity with the issue since they're all receiving referrals to some extent from Department of Probation. The provider that does that targeted work leverages our contract with other reentry services that they provide, so like cognitive, behavioral restructuring, thinking for a change is the curriculum that they use, so they're able to blend the fatherhood work with other services that they're doing.
Thank you. What additional support can a council do to support these amazing programs that are hidden? I think there should be a robust marketing plan to let these know. As I spoke to the chair, so our purpose today is to shed light on these amazing programs that are happening, but a lot of New Yorkers don't know about it. So what can the council do to support?
Thank you. I think this perennial Dad's Take Your Child to School Day campaign is something the council could continue to embrace and uplift. We'll be there, and not only are the father providers there, but we encourage, certainly under my portfolio, we encourage all the CD programs to find ways to participate. So if we can amplify and uplift that, I think that would be great. And stay tuned as soon as we confirm the date for the next Affirming Fatherhood convening. We had Councilmember Riley once. Maybe we can get him back. Maybe we can have some other council members that will join us at that. He'll be there.
And we'll make sure.
She confirmed for all of us.
And we'll make sure Salam is there too, because he has a lot of kids too.
Great.
I know that CUNY has a fatherhood initiative program. Is there any partnership or talks with them?
There is. So we've talked on a regular basis. We had a meeting not too long ago with Natifa Ford and the YMI team. Mm-hmm. The program staff are in communication. We play complementary roles, I would say, and we're engaged in some dialogue about, I don't know where, I can't speak to the details of where this is going to go right now, but we've begun cooperative conversations both with YMI and with ACS, as well as HRA's Office of Child Support. Like, how can we continue to support one another, realize areas of mutual benefit, but also areas that are complementary. So that's going to be an ongoing process, but I'm glad we embarked on that at the end of last fall.
I thank you too, because I'm a mom of 4 boys, so I want to make sure our brothers are supported. Chair Stevens, thank you.
No, thank you. Because I know even we've had conversations about the Fatherhood Initiative, and when we first spoke about it, I remember you being so excited about it. And it's definitely one of the things I think we do need to make sure that we're uplifting, we're talking about, because especially we are a council of women, but we also know about equity, and we know how it feels sometimes not to be part of the conversation. And the father part is often not talked about, and they also need support. And so we definitely want to make sure that we're supporting that program and uplifting it. And Kevin Riley has been very adamant about it. You know, he does his dad gang stuff, and, you know, there's a lot of young men doing great things, especially promoting fatherhood. And so we want to make sure that we're also supporting that, because that's just, fatherhood is about family. And so we want to make sure as we're moving forward, we continue to push forward.
I can come back.
Oh, no problem. Well, Councilmember Williams has to go. So we're going to go into the senior services. DYCD Senior Services for people age 60 and older offers social and recreation activity, integration activities, exercise, nutrition, access to health insurance, medical assistance, and community service. How many individuals is this program served in 2023?
1,160 in FY23 were served.
What are the most prevalent cases senior services program providers are addressing with the NDAs?
Most prevalent of late have been SNAP, TANF, Social Security benefits, emergency food assistance, transportation services, whether van service or Metro cards, domestic violence support, mental health services, avoiding eviction, and receiving acceptance to rent stabilized housing, utility payment assistance.
And I guess, could you talk a little bit about how these programs are working in collaboration with DFTA and those things? Because this programs is more like a supplement to some of the programs that's already in existence, correct?
They serve a very complementary role. Department for the Aging is a key partner for the program, and our older adults, Commissioner DFTA has taught us to say older adults.
Nah, my seniors is cool with me saying seniors. They said they like it, so I'm not changing it.
They utilize space at a DFTA centers.
And so these programs, like I said, they're pretty much like a complement to it, okay?
Yes.
So what's the cost per participant for a senior services contract provider?
$833.
Oh, it's getting lower and lower, huh? Okay, well.
It's higher than it was, but
What was it, $2? That's outlandish and shit. So it has to be a supplement, because there's no way that this could be a standalone program, because with $800, like, I don't know what we're getting with that. This is the first cycle of the economic development programming. During the demands for this programming coming out of the NABs, what made this a pressing issue, and how is the program progressing in the last 2 years with the contract?
Thank you for the question. What made it a pressing issue, I shared some of this in my earlier testimony about the NDA initiative being able to adapt. So one thing I hadn't mentioned, some years back, the way the needs assessments were conducted was fine, and I think you could call it a good participatory budgeting or participatory voting process. There'd be a list of programs that DYCD had been funding, and residents would say which program that they want. And that's fine. However, when we revamped the community needs assessment, 2016, we began to ask the question very directly, what are the highest needs in this community? And there was a broad range of needs. We'll send you the 2020 Community Needs Assessment report again, so you can see there's maybe about 30 different indicators of need. And when we started asking in a more granular way, we asked questions that if we hadn't have asked, we wouldn't have known, like assistance starting a business. And so when that emerged as one of the highest priorities from communities, that we need to have a direct response, and this is one of the highest priority needs. And so that was the creation. Or the relaunching, rather, sorry.
How do economic development programs providers partner with bids, local development corporations, and take advantage of city resources?
Two pieces to that answer, Chair. One, both at inception when we launched the concept paper and we did the RFP, we consulted EDC and Small Business Services. We wanted to make sure we were approaching something that would be complementary but not duplicative of their work. And so we spoke cooperatively and engendered their buy-in. And then once we entered into contract with the providers, each of them do have relationships with bids and with the, what's the other term? My brain is freezing for a second. Excuse me, thank you, local development corporations. And we continue to meet, we actually had a call yesterday with SBS to think of ways to continue to bolster and support the portfolio as a whole.
According to the RFP, economic development contracts are required to utilize the following national performance indicators to measure their outcomes and achievements on a quarterly basis. How many small businesses and individuals were served last year, and how many jobs were created and maintained within the NDAs?
Last year, there were 854 small businesses and individuals served, and we have a breakdown for you of that. 41% of those were aspiring entrepreneurs, 35% were entrepreneurs awaiting licensing, and 24% were small business owners. In terms of the jobs created and maintained, 26 jobs were created within a small business, and examples of that: a small business owner was able to secure commercial space, open their first brick and mortar, and hire staff. 14 jobs were maintained, and an example of that: a participant operating a small contracting business needed financing to maintain cash flow and was able to register as a licensed contractor, apply for a business loan, and get approved for a $25,000 loan.
What can you share the quarterly national performance indicators with the committee?
Yes, thank you.
Thank you. All right, moving on. The goals of DYCD Adult Literacy Program is to help New Yorkers obtain reading, writing, communication skills that they want and need to gain employment and pursue further education. How many participants enrolled in the Adult Literacy Program in 2023?
There were 16,520 participants enrolled.
16,520.
Yes. That's across the adult literacy portfolio.
How do providers recruit for the adult literacy program?
To a great degree, outreach is through word of mouth and referrals from family and friends, but providers also do conduct street outreach, tabling at events and dropping off flyers. Media outreach includes social media announcements and ethnic newspaper ads.
What percentage of high school equivalent participants obtained a diploma in 2023?
In 2023, 1,727 students were enrolled in ABE HSE programs, and 423 students were referred to take the GED. Of the students that were referred and deemed ready to take the GED, 120 students passed and received a diploma.
So 123 received the diploma. According to DYCD's 2020 Neighborhood Development Area Concept Paper, adult literacy education and high school equivalency services are for those at current grade level as measured as the test of adult basic education, TAB. Does DYCD administer TABs for current students and prospective students? And what percentage of participants advanced to the next adult basic education level in 2023?
Chair, I'm sorry, I don't seem to have that figure, but I can follow up with you after the hearing with it.
Thank you, please. That would be amazing. In addition to the NDAs, Adult Literacy Services in 2024 released a literacy service RFP. This RFP included a funding formula based on priorities, neighborhood tabulation areas, NATs. This differs from the previous geographical requirements in literacy service RFPs. Could you explain the reason for the change?
Yes, Chair. You know that we have an RFP that's out now, so I'm somewhat limited as to what I can say, but I can say DYC's equity investment approach for the RFP drives funding into the highest needs communities and accounts for the ways that poverty and other indicators of need have shifted in the past 10 years, using the most recent American Community Survey data by neighborhood tabulation area. It's made available through the NYC Department of City Planning. And this approach reflects DYC's commitment it reflects the commitment of both the administration and DYC to equity. In order to determine which neighborhoods were most in need of adult literacy programs, DYC used the census data to identify NTAs with the highest poverty rates, lowest educational attainment, and limited English proficiency. And the department used census data from 2017 to 2021, which is the most recent data available.
And so this was a decision that DYCD made, that they said that they wanted to use this data to kind of like streamline the approach. So this is a decision that came straight from you guys, correct?
Again, reflecting the agency's own and the administration's interest in equity. We're trying to take advantage of the most recent data and using poverty and English language learners also, as in the case of adult literacy, as criteria to make decisions.
And so even just thinking about this, and this is me just thinking, like, obviously you said the data was used from the last census, but we know that especially with the influx of asylum seekers and, you know, us being in the middle of that, these numbers have changed dramatically. So how have you guys taken that into consideration?
I can carry back your raising the question, the clarifier to the team.
Yeah, because I think that is important. Obviously, I'm always yelling at y'all to use data, so I can't go back on it now. But I think we also have to make sure that we're also looking at current trends and what's happening currently. And it's different than it was 2 years ago, and it looks very different, but the data that we're using, and that's saying like, oh, we're looking at the trends in poverty, it actually looks different now because we had an influx of so many people coming in to the city from out of the country. So I would definitely encourage for us to make sure that we are assessing much more current data, because we know that those things have changed so dramatically in the last 2 years. Are providers who do not have a site within a priority NFT excluded from applying from the literacy RFP?
No, the RFP is open to all. Any organization can apply by proposing a program location within the target NTAs. In response to feedback from the council and others, we've also issued an addendum to the RFP, which allows providers to apply to the NTA closest to their proposed location.
And so and I know previously you had said that the enrollment for the current adult literacy programs are 1,520.
Yes.
And then currently, I believe with the current RFP, those numbers are down significantly. I think we're at like 1,600. Do you know why we are decreasing the amount of slots that we're making available for this adult literacy?
I reported elsewhere in my testimony, and you also opine when you have a fixed amount of money and you've gotten feedback that staffing levels haven't been as robust as you might have liked. If you then increase the staffing levels to provide a more robust service, that's going to have an impact on the total number of slots. So that is taking place here.
Okay. You know, we're doing the RFP now, and we have so much more to work on. So we'll keep talking about this, because I know this is something that's been really important. I've been getting a lot of calls and conversation around this. So we'll definitely keep talking and having these conversations additionally offline. According to DYCD's website, members of the Safety Awareness and Crime Prevention Program community. Oh wait, I think Councilmember Williams is back. I'll let her jump in right now for her questions. I was up to the Safety Awareness and Crime Prevention. Go ahead. No, go ahead. Do it. No, go ahead. You go ahead. Thank you.
Hello. Actually, if I could just ask one question before the safety question about the NABs. I know it says that it's in 41 areas. Does it, because I know I've been having a conversation with the chair, because I know some of the areas, is it by poverty tracks, census tracks? Like, how do they determine?
We are looking at poverty. In particular, because of the CSBG Act, we look at households with 125% of federal poverty or below.
Okay, and I will follow up with the chair and/or DYCD to figure out like my role, because parts of my district are on that census tract and parts aren't, and so just wasn't sure like if it's really the speaker, because we share Community Board 12, and that's the part that has some of those census tracts. So I just wanted to make sure that I could also appoint if there was any areas in my district or if it falls primarily in her district. but that was,
We'd be happy
You have
to follow up with
appointments.
you.
I'll follow up with her. She has appointments. I have the list. I've been working very
okay, then
closely
the
with
other
Anita.
question I have is what the chair was headed towards, which was about the safety and awareness and crime prevention program. We know that members are recruited to engage in the process to identify an issue of concern related to safety and crime and work to develop coordinated prevention and intervention strategies. Can you share what the process is to identify these issues and how you recruit individuals, and what does the prevention and intervention strategies entail?
Thank you for the question. The Safety Prevention and Crime Awareness Program, Safety Awareness and Crime Prevention Program, is one that I'm actually pretty excited about. I think in the main, our NDA programs focus on individuals and families and sort of accessing some benefits. So the fact that this program it works through providers, we're used to that, but the fact that the community rather than an individual is what's being worked on is pretty exciting and pretty welcome, I think, particularly for a community action agency. So there's currently 3 providers at work on this issue, and in operating the contract and following what's expected of them, they have to poll the community. They have to enlist community residents to identify what the highest priority need is going to be. So we have a bucket that says either domestic violence or interpersonal conflict may have been the highest priority need that they have to address, but the community has to put their target on what is it they want to do. I'm going to turn to Assistant Commissioner Jordan Wilson, who could say a little bit more about what's been unfolding.
Yes, good morning. So we have 3 programs, and each program, the scope is kind of tailored to what is happening in that specific community. So the actual community residents that are a part of the program, they're the ones that basically drive what project they want to work on. What is the biggest issue in their community related to public safety. And so we have one program that focused on, there was an area in their neighborhood that was not lit well, and a lot of, like a lot of garbage. It wasn't just friendly to walk by. So what they did was basically painted a mural on the wall to brighten up the space, and they also were talking with other city agencies to talk about getting better lighting. So each program basically focuses on, for the year, like what project they want to tackle that would kind of improve safety conditions in their specific neighborhood.
And this is through the NABs though, right?
This is actually an actual NDA program. So the neighborhood advisory boards actually in these 3 neighborhoods voted that this, based on the needs assessment and the public hearings, that this program was necessary for their communities.
And what communities?
So it's Far Rockaway, we have Bronx 7, and then we also have Queens, so Queensbridge.
And so the people who are a part of the program that are running the actual like NDA program, were they NAB members, or were they other members of the community that were recruited?
Council member, I want to draw a distinction, and I recognize sometimes DYC and other city agencies get caught up in a lot of acronyms, right? So the NABs are Neighborhood Advisory Board members. And then we draw a boundary for each neighborhood that we're focusing on, and we call those NDAs. That's the Neighborhood Development Area. The NABs, as I shared earlier in my testimony, those are volunteers that are working cooperatively with DYCD to canvass the community, to hold the public hearings, to determine the highest priority needs. And then once we have that information, we again meet with the NAB members at particular points in time to say, okay, based on the money that's available and based on the highest priority needs you've identified, you can fund these 3 or 4 program areas. And then they will decide, we want to throw as much money as we can into these 3 or these 4, right? And then again, when we are procuring, they will join us in reading their proposals. Like, you found that this was the need, this is what we're going to fund, these are the people who want to deliver the services, and they're helping us rate and score proposals, so then we find the best provider that's going to deliver that service in that community. So with regard to the program that Assistant Commissioner and I were just talking about, the safety and crime, for those 3 neighborhoods where this is one of the highest priority needs, we identified a provider that's going to work in those neighborhoods. And part of their program design is they have to enlist the community. They cannot even attempt to try to solve the problem by themselves because it's a community problem. They might invite NEB members, just like any other residents of the community, to be part of solving the problem, but not every program necessarily would do that. This one might, because it's about raising the community awareness. So you would pick up, you're saying about a mural? So then once it was identified that they were going to work on a mural, then who's going to do the mural, and everyone kind of pitching in and working together on it.
So do you have a provider facilitating or coordinating the NDA project in each community, or do you only bring on a provider once a project is identified?
We identify the provider first.
Okay.
And then in the case of this program, the provider has to, as part of their service strategy, host whatever meetings need to happen and broker whatever alliances need to happen to have the community identify and then work toward designing whatever the solution is going to be.
And the providers are selected by the same like procurement process?
Same procurement process.
Okay.
Yes.
What are the providers for the 3 programs?
Do you remember offhand? Yeah.
So in the Bronx, we have Marshall Montefiore MMCC, Community Center, and then we have, for Far Rockaway, we have WAG, so Wheelchairs Against Guns, and then in Queensbridge, we have Jacob Reese.
Okay, I have more questions, but no, I just, because I know some providers lost certain contracts, like you mentioned WAG and Far Rockaway, and I know there were other providers that were indulging in different work around like crime and safety prevention. So I'm just trying to, these are all different contracts, right? Like this isn't the same as like a CMS or other types of contracts that would come out. This is very specific to this NDA program focused on safety and crime prevention. That's the proper name, right?
That's
Safety
true, but
Awareness
Council,
and Crime Prevention Program.
that's true, Councilmember, but I want to add something. When the priorities were identified and the programs were defined, and when we went to procure for this, that all proceeded when the Office of Neighborhood Services was integrated into DYCD. So since that has happened, and consistent with what the chair was saying earlier, like the left hand wants to know what the right hand is doing, Ebony and her team have been meeting with the ONS team. So when we think both about existing CMS work, and also there's an array of strategies where we're trying to grow similar work. We just had 2 meetings 2 weeks ago and 3 weeks ago. We have another meeting next week where we want to pull these providers into, not that they aren't already, but a stronger coordinated discussion with CMS providers when they are in neighborhoods that overlap work that's happening in CMS.
So you are ensuring that.
Oh, we're actively talking about it, and then what's the 2 of the 3 do and 1 doesn't, right?
And some of these providers have multiple contracts.
Yes, that's true. So because of the nature of this work, we want them to wrap arms around whoever else is in the community. So if they're CMS-funded providers, they should be part of their planning. And so for the one that's in a neighborhood that isn't one of like the target precincts right now, we still want them to use the same methodologies because that could later on become part of the CMS work or related work. So we are in cross-pollination discussions about this.
I understand, like, and I know that you guys have been trying really hard around, like, trying to get everyone to work collaboratively and having the work be cross-pollinated and all that, but, like, it just seems so confusing because this all seems very overlapping, especially with the safety awareness and crime prevention is doing the same work, very similar work that CMS is doing, and then we also have the MAP program. Like, everyone is, like, doing the same thing, and so we wouldn't have to do so much cross-pollination if we kind of like just did the work and not like had all these different providers and these different buckets. It just seems very confusing. And then we have all the acronyms. So I feel like if I'm confused, I feel like other people might be confused. And so I don't like things that don't make sense. And so I really want us to, like, as we're moving forward, think about how do we get to a place where it's like kind of not like all over the place, because obviously we all have the same goals, but it also thinking about how are we making sure that, like, if these are CMS groups, then how do we reach out to those groups to kind of work with them to get these contracts and kind of streamline it that way? Because then you have like Montefiore is doing this safety and awareness and crime prevention, but like that's not what the work that they're doing, right? Like it's just all over the place. And so I definitely want us to continue to think about, like, as we're moving forward, how are we kind of like streamlining it and putting things in buckets, and like, because what happens is, and this is the way that things have been for years with nonprofits, we throw out these contracts and everybody applies for everything, right? And like, one of the things that I keep telling people is, like, when administration changes doesn't mean that you have to now change your mission and your vision because we're chasing the dollar. And so we have to do better at saying, like, okay, well, what is the work? Who's doing the work? How do we work with these groups to continue to do this work or strengthen it or move on other things? But it just seems like it's just a lot. And it's, the more we're adding on to it, the bigger the mess I feel like we're making, although we have good intentions. I do not think I have any more questions right now. But I think Councilmember Joseph has said it earlier. I just really want to talk about, like, with all of these programs, and especially this portfolio specifically, I think that there's a lot of good work there, but really would love to open it up to you guys to just talk about how do you guys think you can work with the councils to kind of uplift these programs in a better way, and not just the NAB and the appointments, but like all of these things, because a lot of people just don't know about them. And so I just want to leave that with you guys to be able to talk about what the collaboration can look like moving forward.
Thank you for that. Final question. I think some of the things that we talked about briefly, we should really invest in and return to. I thought the virtual briefing was excellent. I think we want to routinize that. I think anecdotally, and I won't say the council members, I won't point to any particular local elected official, I think at times people seem very excited about the work, and then I'm not always clear as to why they lose interest, but I would like for us, for our part, for us to continue to be consistent. I agree with you, Chair, that even though these programs have relatively less funding or smaller funding than some of the city tax levy, they're important programs, and we are looking to maximally leverage the work that they can do. It has always made sense to me. Commissioner Howard refers to CD as the other side of the house, so we do all this youth work. The work here that we do with adolescents, adults, older adults is really very hand in glove. So if we can work together to share that message, we're a year away from doing a whole other community needs assessment. So let's see what we can do to really continue to raise the profile. And as always, we're happy to share the impacts that we think we're having.
Yeah, definitely thinking about, we are a year out from the community needs assessments, which I'm definitely excited to be a part of again and make sure that we get it out. But I think that that's one step in using this year to kind of get people up to date on what the community assessment is, so that when we do launch it, my office isn't the only one doing surveys, right? And so thinking about how do we make sure that in a year, all 51 members know about it and a part of it, all the state electeds are a part of it and know about it, and thinking about what we can do to do that. And also, a lot of these price points are low because it does have to, so that means they are going to be attached to some of the other things and work that's going on throughout the city as far as programming. So thinking about how do we use those programs to also uplift this work as well, because it is very much needed. And you guys are one of the secrets in DYCD that no one kind of talks about, but I told you I wasn't gonna forget about you.
Yes, and thank you for spilling the beans.
I did. Listen, you know, sometimes you open that door and you be like, all right, no, close it, because I don't want people to know what we're over here doing. But Councilmember Williams has another question, and then we'll go to the panel.
Yeah, I was trying to see if you guys answered this already, but I know you mentioned, you know, what constitutes as like a functioning NAB, but was interested in understanding, like, when you don't have a functioning NAB, what happens to that community? Are you able to still continue your work? What happens?
We are able to still continue the work. I mentioned the staffing pattern right now. So The liaisons attend all of the NAB meetings. And so just what we want is for every
Those
board.
poor 4 people have to attend all the meetings?
Yes, they do.
All 41?
I was like, wait,
They do.
the 2 people? How they do?
The staff
Oh
have
my
to attend the
gosh.
meetings.
Wait,
They
but
have
if
to
they're not-
ensure
Anita
that
need a raise.
If they're not functioning though, are they even having meetings?
No, I didn't say that they weren't functioning. They are functioning. So what we
Okay.
consider viable is when a board is healthy. So, for
Okay.
instance, a board ought to have someone who's serving as like the chair of the board, and someone serving as the secretary of the board. You don't want the same person to have to do all the things, right? The liaisons will step in if there's a need for them to step in, but mainly what we want them to do is to empower the volunteers. Not every volunteer knows Robert's Rules of Order, but if the liaison knows it, this is how you do this is how you do it, that sort of thing.
How often do they meet?
At least quarterly. It depends on whether it's a community needs assessment year, so 2022, and again, next year they'll meet much more often, but at least quarterly. 4 times a year, each one, yeah.
Is it like, are notes available from the meetings, like community boards are is it the same level of, like if I never attended a NAB meeting, could I know what was discussed in?
Yes, we can share that with you.
Is that public knowledge? Like, is it on the website or something like that?
Yeah, they're on the website, both the NAB and announcements of meetings and the CAB and announcements of meetings, and then the, I have to check if all the I don't want to say anything out of my depth. Yep, all the meetings are published on the website for sure, and we can also share via YouTube the Community Action Board meetings.
Oh, it's on YouTube. Are you done? She said, what's Community Action Board?
Each neighborhood advisory board focuses on a particular community. DYC also has a central board. It's a tripartite board that has some representatives of local elected officials in the private sector, but half of the board on our Community Action Board are people who are representing a range of NABs. And so those neighborhoods sort of vote them up to be on our Community Action Board.
So are there 2 boards? There's a community action board and then there's a central board. Is the community action board the central?
The Community Action Board is the central board.
Oh,
So we
okay.
have neighborhood advisory boards, but we also have a Community Action Board. That's also required by the federal statute to have a
There's one
tripartite board.
community action board for
There's
all of
one
New York
community
City.
action board.
And there's NAB members and others that funnel into the community action.
That's correct.
Across the city.
Yes.
This is good clarification. No, I mean, these. I just want to say those are real questions because I told you they don't know. I've been calling offices.
A frequently answered question sheet that we have that that also spells out how both the Community Action Board and the Neighborhood Advisory Board members.
Yes, please email that to me again, and I will
Happy to.
email it out to all of my colleagues today.
Thank you.
Thank you guys so much. We do have some testimony. Hopefully you guys can stay around to hear some of it. And I will turn it over to Christina so she can take it from here.
All right, thank you, Chair. We will now turn to public testimony. We will be limiting public testimony today to 3 minutes each. For in-person panelists, please come up to the table once your name has been called. Our first in-person panel will be Ira Yankwit, Maria Ferreira, Anna Kaganova, and Dionis Fernandez. You can begin when ready.
Good morning, Chair Stevens, My name is Ira Yankwit, and I'm the Executive Director of the Literacy Assistance Center, a 41-year-old nonprofit organization dedicated to strengthening and expanding the adult education system and to advancing adult literacy as a foundation for equal opportunity and social justice. As you know, and as you've just been discussing, DYCD currently has an open RFP that will fund community-based organizations to lead adult basic education, high school equivalency, and English for speakers of other language programs for the next 3 to 6 years. DYCD has structured this RFP to prioritize residents of the highest poverty, lowest educational attainment, most limited English proficient neighborhoods in the city. We unequivocally support this goal. Unfortunately, the way DYCD has structured the RFP through a two-tier funding competition could effectively render up to 70% of the current community-based adult literacy providers non-competitive, forcing them to close their classes and displace thousands of the very students that DYCD is aiming to serve. We are very grateful to you, Councilmember Stevens, as well as to Council Members Juan and Aviles, and the 38 other council members who signed on to your letter urging DYCD to revise this counterproductive competition model and to expend the proposal deadline. The irony is that while DYCD wants to address neighborhoods with the highest needs, the $11.85 million in funding in this RFP is $5 million less than the $16.83 million in current administration-side funding for DYCD adult literacy contracts in FY24. This means that this RFP will serve just over 9,100 students annually, a significant decrease from the 16,000 that DYCD just reported, and less than 0.5% of the 2.2 million adult New Yorkers in need. At the same time, the mayor's preliminary budget for FY25 includes $21.7 million for DYCD adult literacy, nearly $10 million, or nearly 85% more than what is currently included in the RFP. If this additional funding could get baselined and included in the RFP, DYCD could do some combination of the following three things. First, it could increase the per-student funding rate, which would make it more realistic for smaller organizations, those that don't have additional sources of revenue to supplement the DYCD funding, to apply under this RFP and to be able to provide more comprehensive services. Second, it could increase the number of neighborhood tabulation areas designated for funding and increase the number of students served through this RFP. And third, it could create a second non-NTA-based competition for providers who wish to run borough-wide and/or city-wide programs and increase the number of students served through this RFP. With the March 20th deadline for organizations to submit proposals fast approaching, we urge the committee to get clarity on the funding and push for a baselining of the full $21.7 million, as well as to continue to push to fix the competition model and extend the deadline further. Thank you for your attention.
Hello, my name is Dionis Fernandez. I have a movement called Fathers Speak Up for fathers that are fighting to be part of their children's life. I just did a nonprofit organization and my 501c. What I do is I go to all the 5 boroughs and I speak to fathers that's been going to court, paying child support, hiring lawyers, and we still don't get the justice we deserve to be part of our children's life. I got 3 years fighting to see my child going to court, and they're not giving me the right that I deserve. And there's a lot of fathers out there paying child support, and we don't know where the money is going. We should have like a food stamp sample so we know the money is being given to our child, not the mom using the money doing her hair and things like that. The law just changed in Florida. That fathers and mothers, single, divorced, still could have joint custody. It's going into effect July 1st, and I believe that we should be able to do this here because it's very important for the children to have their fathers in their life. When you go to court, they always talking about the mother and the father, and they're not able to co-parent, so it's supposed to be wasn't the best interest of the child, but they always talking about mom and father issue, which that's the past. They're not working things out, so they always gonna be talking about them instead of talking about child because we missing being in our children's life. We fighting to do everything we can. We get no type of visitations, phone calls, and fathers are going this through for years, and it's time for us to change this and for us to be part of our children's life because we are fathers and we great fathers and we deserve to be heard and we deserve to get the 50-50 joint custody the same as the mother because it's important for the mother to be there such as the father too. Thank you.
Hello, Councilmember Stevens. Thank you so much for giving us the opportunity to share this important testimony about our very successful Healthy Families program. My name is Anna Kaganova, and I am representing Center for Family Life in Sunset Park. We are a neighborhood-based social services organization that provides services in Sunset Park, Brooklyn, CD7. Our programs include a wide range of wraparound supports ranging from food pantry, benefits access, immigration and non-immigration legal services, employment and job placement supports, ESOL, cooperative business development, after-school and youth development, among others, serving 15,000 people in a year. Sunset Park, our neighborhood, is a low-income immigrant community with many immigrant families hailing from Latin American, Asian, Middle Eastern, and Russian-speaking countries. Many immigrants in our neighborhood lack the language skills and familiarity with American systems, which make it challenging for them to assimilate to life in the United States. Our NDA Healthy Families program provides case management, educational workshops, service navigation supports to our clients, offering them the invaluable guidance and orientation, which help ensure that families are able to receive stability. Our program has served in the prior years over 70 people each year, and this year we intend to serve 106 people. The supports in our program include job readiness, job placement, help obtaining identification, benefits access, help obtaining health insurance, housing referrals, workshops on tenants, immigrants, and workers' rights, financial literacy workshops, and individual counseling, among others, as well as help navigating public systems, including the healthcare and the education system. These wraparound supportive services offered through our Healthy Families program serve to address multiple issues faced by families, providing greater overall stability and well-being to the families we serve. Our services are also provided in a culturally and linguistically competent manner by bilingual and bicultural staff, ensuring that all services are appropriate and relevant to our clients. In face of the current migrant crisis, we have served over 2,000 asylum seekers at Center for Family Life, and we have witnessed the exponentially increasing need for support in New York from both long-term residents and new arrivals. Our Healthy Families program is an incredibly valuable resource, again, in this face of compounded growing need for social services in the city, and it helps families receive enhanced stability and well-being, creating a ripple effect in the community that makes it overall more resilient and thriving. Hence, this is a very important, necessary program. Thank you so much.
I do have a couple of questions for the panel. I guess I'll start with the adult literacy. One, thank you, because I love that your testimony has solutions to some of the problems, and you laid them out very nicely. But I guess as you can see, some of my questions in the hearing was just more about like the data that they're using for the NFTs or whatever they're calling it. Is old data, and thinking about how, you know, we have this asylum crisis going on in the city. What are some suggestions? Because it was kind of alluded to that there is limited resources with that, but what are your suggestions around that? Because I know that like it talks about like the NAC's designated funding and increasing the NFTs, but if there is limited funding, one of the issues we had before when they released the RFP before was that the price point was too low. So can you talk a little bit about that?
Sure. So as you pointed out in your conversation with Deputy Commissioner Bobbitt, that not only is the data going back 3 years, I think he said, to 2021 at its most recent, but also this RFP is 3 years with a 3-year extension, which will almost certainly be exercised by DYCD given its history. So we're now looking at data from 2017 to 2021 that is going to be used to determine what neighborhoods programs are in potentially 2029, 2030. So we already know that data that goes back 3 years is likely out of date, right? Given displacement, gentrification, and of course the influx of new asylum seekers. So I'm very concerned about this as a model, while obviously I really applaud and share the goal of targeting limited funding. And I think that if we were starting from scratch and there were no community-based organizations that were currently being funded to provide these services, and you said, look, Ira, we have limited dollars. Now, we can argue whether or not we should have limited dollars, if there are really limited dollars, but that's our starting point. And we want to focus on the highest poverty, lowest educational attainment, most limited English proficient residents of New York City to get them the classes that they need. The way we're going to do that is we're going to look at the best data we have, which is the NTA data, and we're going to target those neighborhoods. If we were starting from scratch in that hypothetical scenario, this might make sense. But the reality is we are not starting from scratch, right? We are starting with a pre-existing system that has high quality, high impact adult literacy providers all over the city right now, right? We also know that the nature of adult literacy students is that they don't necessarily want to or are not necessarily able to attend school in the neighborhoods that they live in. Some of them want to attend classes closer to where they work, or where they have family that can provide childcare, or maybe they're just interested in going to classes with people from different neighborhoods of the city, as many of us are when we choose to go to a class. So I think what DYCD is doing is it's undermining its own goals. It is certainly true that after the initial RFP, where they said only providers that that were located in the NTAs could even apply, and we saw that 18 of the NTAs didn't even have obvious providers or organizations that could provide these services, that they said, okay, we will, as the Deputy Commissioner mentioned, open up the application to any provider as long as they target one of the NTAs. The problem is, if you are not currently located in the NTA, you are not even, as we understand it, considered for funding if there is a provider within the NTA. So this becomes a real deterrent for any current providers to apply, right? I don't necessarily know if there is a provider, a potential provider in the NTA that I'm closest to. Also, what if I'm between NTAs? Which one am I supposed to apply for? Or maybe there's one a little further away and I know there are no providers there. Can I apply for them? They are creating a complication that they don't need. What they can just simply do is open up the competition to any provider who wants to apply, and then they can include geographic considerations in their evaluation method. It's not at all clear to me how this two-tier system helps and serves their cause. And of course, the irony is that in the name of equity and justice, they actually are putting $5 million less into this funding than they had this year, and going from 16,000 students to 9,100 students when we have a need of about 2.2 million adults. So it's a little ironic that this is all in the name of equity and justice.
Yeah, I mean, even thinking about it as you were talking, I'm like, dang, I should have asked the question, are they, when they were considering this, are they looking at areas where we're building up, right? Because we are in a whole housing crisis, right? And there are areas that are being built up that obviously aren't a part of the NTAs now, but might become because we have the influx of affordable housing going into these areas. So we have to ask that question. Let's email that to them as well, or if you can take it back from me. Because I think that is gonna, I want to understand how was that taken into consideration, especially when we have the City of Yes going on as well. But like I told them, this is going to be an ongoing conversation, obviously, for us for the next couple of weeks. I did have a question for the young man with the Fathers Initiative. Have you taken advantage of any of the services that DYCD is offering with their Fathers Initiatives, and have you worked collaboratively with them at all? You have to turn your mic on, baby.
No, I just started this movement now. I got a big platform, so what I do is I just go to the 5 boroughs. If the father's been doing everything they can as fathers, what I do is I make an interview about what they're going through. We don't talk about the mother, we just talk about how we fathers and everything we're doing to be there for our children, and we still are not able to get the justice we deserve.
Yeah, I would love to see how we can connect you with the work that they're doing with the Fathers Initiative and what you're doing, because it definitely sounds like there's some overlap there as well. And I know that there's like a whole bunch of organizations doing, not necessarily that piece, but like I know like Councilman Raleigh, he's part of the Dad Gang and all those things. And I would love to just see how all of those things could be integrated, because it is true. We often talk about the mom and don't talk about the dad, and want to make sure that we're highlighting.
So what's going on now is, like, let's say if the child is 14, 15 years old and he's able to reach out to his father. So what kids are doing when they get that age, they want to reach out to their father to see why you wasn't in my life. And now the fathers are showing proof, I've been trying to be in your life, but they just not giving me the justice. So now a lot of kids are being mad at the mother. They don't want to be with the mother, and they just want to be with the father for taking his right away to be with the dad. So we need to do something about this, because I believe it's very important for children to have their fathers in their life. And when you go to court, it's supposed to be what is in the best interest of the child. But like I said, they always talk about mom and dad problem, and if we're not able to work things out, we're always going to make one look better than the other. So I just want it to be about what can we do for we could both just be able to be there for our children, mom and dad.
Absolutely.
Thank you.
And I think we're all on the same page, but I don't have any more questions for this panel. Thank you all for being here. I really appreciate your time and your effort and your energy and the work that you're doing.
Thank you.
Thank you so much to this panel. That concludes our in-person testimony. We will now transition to remote testimony. For virtual panelists, once your name is called, a member of our staff will unmute you, and the sergeant at arms will set the timer and give you the go-ahead to begin. Our first panelist will be Ursula Cooper Hunter. Ursula, you may begin when the sergeant starts your clock.
Starting time.
Okay, good morning. It is still morning, yes. Good morning, City Council Member Stevens and the committee, Children and Youth Committee. I am the Department Director for Bronx Works Children and Youth Department, and we certainly appreciate the opportunity to submit written testimony to the Committee on Children and Youth. Bronx Works was founded in 1972. The Bronx Works mission is to improve the economic and social well-being of low-income individuals and families. We feed, shelter, teach, and support our neighbors to build a stronger community. Bronx Works currently has the following DYCD children and youth programs. We have 5 campus after-school programs, 3 Sonic, 2 high school after-school programs, one of them being an NDA program at the Adlai Stevenson campus, a WIOA program, as well as 3 cornerstones, and a summer youth employment contract for 1,300 young people during the summers. So we certainly appreciate the DYCD Children and Youth funding, and it is in alignment with the Bronx Works mission to teach and support our neighbors. However, during this post-pandemic era, it has become increasingly apparent that a higher participant reimbursement rate is needed. This will enhance DYCD programming to allow programs to better serve our youth population. And some of the areas that would be important program enhancements would be things like swimming programs, so that our inner city youth can have swimming instruction, enhanced literacy and STEAM programming, social workers to support and address the social and emotional needs of youth, budgets which accommodate a floor salary of $22 an hour and $25 an hour during the summer for group leaders and youth workers, and increased salary rates for instructors and program leaders. A 12-month contract as opposed to a separate summer contract, which will allow organizations to better plan and budget. In terms of the NDA, something that we've experienced during the most recent NDA RFP, where the priority areas shifted. And so as a result, areas where we had some high school programming, the priority was no longer academic support for high schools. And as a result, some of the high schools we had to leave were pretty upset and disappointed, because the need, even though the priority area,
Thank you. Your time has expired.
Oh, okay. I can share my written. I can share the rest of it. Thank you for your time.
Thank you to this panelist. This concludes our remote testimony. If we missed anyone who would like to testify virtually, please use the raise hand function in Zoom. and we will call on you in the order of hands raised. Additionally, I will call those who registered to testify remotely to see if they are online at this time. Shirley Fevrier, Omira DeLeon, and Chakra Sargent.
Good morning. Good morning. My name is Shirley. As a provider of housing and family services that provide service within NDA Area 17, our organization is dedicated to supporting seniors and their families in accessing better resources and navigating housing challenges. Our NDA program offers a range of services, including housing, counseling, and family support aimed at facilitating access to affordable housing, SNAP benefits, and Medicaid. Through our proactive outreach approach, we engage with families to inform them of their tenant rights and provide assistance in resolving landlord-tenant disputes. We prioritize ensuring that families have access to adequate rentability in their apartments, advocating on their behalf to uphold the housing standards. Additionally, we streamline the application process for public assistance programs, offering translation assistance in Haitian Creole to overcome language barriers and ensure equitable access to services. By accommodating families from diverse backgrounds, we strive to create an inclusive environment where everyone can access the support they need. Our commitment to empowering families extends beyond immediate assistance. We offer self-advocacy workshops to enhance their skills and promote self-reliance, equipping them with the tools to navigate future challenges independently. Securing funding from the Department of Youth and Community Development is critical to sustaining and expanding our services. With additional resources, we can continue to provide essential support to seniors and their families, ultimately fostering greater self-reliance and resilience within our community.
Thank you for your testimony. Okay, if there's no one else that would like to testify remotely, I would like to note that written testimony, which will be reviewed in full by committee staff, may be submitted to the record up to 72 hours after the close of this hearing by emailing it to testimony@council.nyc.gov, and I will turn it to the chair for closing statements.
I would like to say that I'm really excited that we were able to do this hearing today, just because these are programs that I think definitely can supplement a lot of the work that we continuously fight about but don't get a lot of attention. I definitely want to make sure that we continue to push and talk about the adult literacy. I'm very concerned about the RFP that was just released, and want to make sure that we can get that to a place that makes the most sense and most equitable and can serve as many people as possible. The Father Initiative is another initiative that I really want us to make sure that we're uplifting and people know about this program to ensure that fathers across the city has support and access. And we want to continue to just make sure that, especially when we're talking about community safety and awareness and crime prevention, that we're not duplicating services and that we're doing things that are more streamlined and more collaborative and making sure that things are always making sense. And so I know that DYCD is making great efforts to be more collaborative and streamline processes, but let's continue to push that work and have that conversation. And with that, this hearing is adjourned.